Welcome to Common Sense. The Common Sense program is a series of shows that feature interviews with very interesting people so that we can learn in a clear, concise, and direct way who these folks are, what they do, and what makes sense to them and what doesn't. I'm Rudy Breglia, and today I'll be interviewing the learned and healing psychologist and Catholic therapist, Dr. Marcel Lanahan.
Hey, thank you, Rudy.
Okay, Marcel, welcome to Common Sense. Before we get started, if you can give us a little background, where you were born, where have you lived, and tell us about that.
Sure. So I was born and raised in the Corning, Elmira area of Western New York.
Familiar, yes.
Yeah. And I bounced around, living in different locations in my life. In Portland, Oregon.
Wow.
Lived in the Midwest for a while. Certainly where I went to school out in Indiana at Notre Dame, and master's in Steubenville, and lived in Northern Virginia. And I bounced around quite a bit, but the last 12 years or so, I've lived in two places. One is Nebraska,
Okay.
and the other is back in Western New York, where I currently live, Alfred, New York.
Okay.
So, yeah.
Before we go into your area of expertise, what was most difficult about raising 5 children with Maria?
Yeah. Well, it's still difficult, right? It's so it's we got 5 little boys between 10 and 4, and they're pretty rambunctious at times. Good boys, but there's just a lot of needs. A lot of needs to be met and a lot of things to be done. We homeschool as well, so
Wow.
We do it all, right? We're the janitorial staff, the cafeteria staff, gym teachers, and
I see.
and by we, I mean my wife. She does a lot of it.
I would imagine she's
But,
heavily involved.
She does great. Yeah. But yeah,
Okay.
there's a lot of difficulty with that.
Well, what was the most surprising aspect thus far of dealing with children?
I'd say I'm surprised by how often I say the word cute every day.
Yeah.
I just they're lovable guys, and even when they're throwing a tantrum, pouting, being difficult with behavior or not listening, right? They're just still so cute, right? I know the older one might not appreciate me saying that right now.
Cute. Okay. Tell us about the steps you've taken in your career.
Sure. Okay. So I'm a bit of what you might call a late bloomer.
Okay. All right.
So when I followed the usual script in the family. I went to Notre Dame, got a degree in engineering. But when I hit my 20s to make those big decisions about career,
Sure.
vocation and things, I floundered, right? I had no.
Okay.
I was not really connected to my heart. I made decisions based on my head and what I thought might work, based on different, I don't know what criteria I used.
Uh-huh.
So I tried teaching. I did try some engineering work. I even tried religious life, right?
Mm-hmm.
With the Dominicans.
Okay.
Great, amazing religious order. The province of St. Joseph, East Coast. Really loved them, but again, it just wasn't for me. So,
All right.
But yeah, eventually I found counseling, and I never looked back. I love it. I got my master's at Steubenville 13 years ago. I got a doctorate in psychology because I love learning, but I've done a lot of private practice work in the last 7 years or so, which I love too. So.
Why did you pursue a career in psychology?
Yeah, so I floundered, as I said. I really struggled to, with certain things, with decisions, and I loved the faith, right? I had this awakening in the faith. I loved the faith, and I knew I just had all these resources, in knowing how to live life well. And but it wasn't until I finally took the advice of a spiritual director and I saw a counselor.
Okay,
right,
all right.
That things changed for me. So I went and I was just blown away by how just a few sessions with that counselor
Made a difference.
made a huge difference. And,
Okay.
I got into my heart and I was able to make decisions, and it was great. So that's kind of what I do for people today.
Okay. Well, so my next question was going to be, did you have a role model? But you just told me that you did.
Sure. Yeah. As far as role models, I'd say some of them were priests. One, I remember a retired pastor. I was 7 years old. I just was attracted to him. He was an old Irish priest,
Okay.
cut from that cloth, in that gentle Irish way, and the wit and the humor. Father O'Brien, and he was great. And so that's who I try to be like today. He really made you feel special and like you matter, and he's listening and encouraging in the faith. That's kind of what I like to do for people who come to see me. But then there's also, Dr. Peter Martin, who's a psychologist out in Nebraska. I worked with for a number of years. Ian Butler's another Catholic therapist and mentor. Just great guys that I really strive to be like. So.
Okay. Well, what is a therapist?
So a therapist is a trained helper.
Okay.
We've had, we've studied, we've learned techniques and processes, but we help with, emotions and mindsets and relationship problems, right? A physical therapist, helps recondition some part of your body. Mm-hmm. Say a mental health therapist helps you recondition your subconscious, right? So learned reactions and stuck moods and things. So that's what I'd say we do on a day-to-day basis. So.
Well, what is a Catholic therapist?
Okay, so with the Catholic therapy versus a secular therapist.
Okay.
First of all, the Catholic therapist sees the person according to the Catholic worldview, right?
Okay.
Generally, we've studied a lot of philosophy and theology in addition to psychology, right, to get a sense of who this person is and how they're built, how they're made, right? So that's the baseline, right? Having that lens.
Okay.
But I'd say, with when you go to a secular therapist, you go into therapy, and a lot of the approaches we learn as therapists come from a different philosophy, a humanist philosophy, right?
Okay.
So that, the belief there is in the human potential and changing things with reason and science and technology and God might exist, and you have your view of God, I have my view of God, but really, we're here to fix ourselves, right? It's on us. We've got to do it all, and they're not really open to bringing in, the faith and what I consider the true source of healing and change. So that's what I offer to people with Catholic therapy, right? Yeah.
Understand. How does Catholic therapy contribute to someone's growth in virtue, holiness, and living out their life's purpose?
Yeah, so with Catholic therapy, maybe I'll tell you a story of a client who just recently she had a major breakthrough, right? A big emotional, spiritual hurdle, obstacle that had been, she'd been suffering with for a long time.
Okay.
And she told me, she said, without, I don't know how people do it, if they're going to a secular therapist, at least with what I was struggling with, right? I would never have gotten to this point without this environment, right? Without what we were doing together. So she really valued the Catholic, viewpoint and what we did together. She was saying, well, I got a friend who, is going to a secular therapist, and they're working on symptom relief and coping. And I don't want to denigrate what another therapist is doing, but with what she was struggling with, which was more emotional and spiritual. So I don't want to reveal exactly what that was, but there's some difficulty really taking in love from others, right? Giving and receiving love, and feeling okay with that, and feeling like it's good. It's not wrong. And so it was just a really powerful experience for her. So yeah.
Understand. What is your mission?
My mission is to provide step-by-step guidance to faithful Catholics and others, right, who are looking for healing and growth in some area of their lives, right? I think of, where I was in my 20s and having a hard time finding my way, and what I really craved back then was that step-by-step guidance on this is what you're going through, and this is how to get to the next step, right? This is how to get there emotionally and deal with this issue. And so it's just a privilege. I do that every day, day in, day out, and I love it. It's just really
very rewarding.
It's very rewarding, it really is. Yeah, just to know that I'm helping someone get that relief, right? That relief and that confidence, and just a few sessions, and they're on their way usually. So yeah.
Great. What are traumas?
Okay, so this we're getting deeper, right? Heavier topic.
Okay, all right.
But trauma is, there's a couple of different ways to think about it. One way that I came across is that it's anytime some pain, a pain of some experience, is too much for us to bear.
Okay.
So, it's greater than our heart's capacity, and so that painful experience can get stuck, and we can, part of us can be stuck reacting to that experience as if it's still happening, right? Or,
sure.
The images, the thoughts, the feelings, the sense that God isn't there, those things can kind of be stuck and then stored in your subconscious, right, in a certain type of memory, an emotional or implicit memory. And, it's stuck until that experience is resolved and processed, right, and talked about. So, that answer your question?
Yes, yes. What is an emotion?
Okay, so an emotion is, emotions are, they're what give us life, right? They're what energize us and drive us. They're like motors, they move us to respond to certain things. Mm-hmm. The cute puppy on YouTube, right? Or the, the painful feeling of when you're dismissed or ignored, right? And these feelings give us some insight, and they move us to respond to these situations, right? So very important. A lot of people dismiss them. A lot of people either deny emotions. Maybe some Catholics are guilty of that, right?
Okay.
Or some, you can also give in to them and let them run your show and get carried away and surrender and not control them. But really, with emotions, you want to get insight into them, right? And so, I had somebody come in who, he's in his 70s, and he was saying, I've never really been connected to my feelings.
Oh.
I've had a lot of success in my life, and I've got family and things, but I just really am struggling to feel things and to go through and enjoy my retirement and things like that. So they're very important, and it's never too late, right? It's never too late to discover those things and to learn how to relate to emotions and to work through the painful ones that we're kind of stuffing away. So yeah, that's what I'm here for, right?
Okay.
Yeah.
Well, along those lines, what is your unique approach to emotional healing?
All right, so let's say somebody comes into my office and they are struggling with anxiety. I'm just going to keep it very vague, right? Anxiety. What I would do with them is I'd first give a couple practical techniques. You know, it's just good to be able to get better and better at shifting out of that anxiety whenever you need, you know, to get recollected, to get more grounded. But then we go into the deeper work, okay? I didn't always used to do this, but I go right in usually in the first session, if
Okay.
somebody's open to it and they can handle it, we'll go into their emotions, okay? And, you know, I'll ask, what's the thing that's triggering the anxiety? Or when do you feel it?
Okay.
Okay, and I'll have them I'll imagine, okay, well, the last time I really felt this anxiety was 2 nights ago. I'll say, okay, what happened 2 nights ago? And so we'll go to that experience, right? And, you know, we'll explore the emotions and and the thoughts and things. But then we'll go into the past with it, typically. You know, if this is a familiar anxiety that they've had before, we'll go into, you know, previous times that they felt it. And so what we want to do is we want to bring to the surface the root cause of this anxiety.
Okay.
You know, finish this phrase, roses are red, violets are...
Blue.
Okay, but are they blue? They're not, right? Yeah.
I
So
see.
where did you learn that, right? When did you learn that? And so that's more cognitive, right? But basically, we're looking for you know, learning of the heart, you know, learning of the emotions and responses.
Okay.
When did you learn to react to these type of situations with anxiety, right? Sometimes it's, you know, oh, this is, oh, I know where I picked this up, right? 2 years ago, I had this boss, right, who just really laid into me and it gave me a hard time, right? So, you know, typically people know, like they'll know right away. Sometimes it takes a little time, and a lot of the times we'll go even further back than that. We'll go into childhood, right? I had somebody the other day, we went to, the memory that came up was around age 4 or 5.
Wow.
You know, and that's where they learned it, right?
That's going back.
That's the time. So my approach is more about, you know, it's not asking why so much. It's when. When did you learn this? And then we get to the root causes of things. You know, that's the first stage, right? It's a 3-stage process. We want to surface things, surface the root causes. Then the second stage is shifting. Okay, so shifting whatever's unresolved, which, you know, I don't want to go into too much detail on what that means, but things that are unresolved in your memories and in your subconscious, we want to shift those things to resolved. Okay, so there's a number of techniques and approaches. Typically, we'll use guided imagery, right? We'll have, you know, their adult self go back in time and talk to that 5-year-old, right, and help that 5-year-old get unstuck from those feelings and, you know, give an update on where they are now. You know, those kinds of things. Sounds cheesy, right? Kind of working with the inner child. But it works because it's the subconscious. It doesn't respond to lectures and words and talking and oh, I got to change myself. It doesn't really respond to that, right? It's imagery and dialogue. Another approach in that stage is called EMDR, eye movement desensitization and reprocessing. So I'll have somebody focus on unresolved memories, and, you know, we'll do back and forth eye movements to help their brain process those memories. Sometimes it's back and forth tapping, right? If we're doing more remote work, distance work. That's another thing that helps shift the subconscious. So that's the second stage, right? Integrative writing, right? I'll have, you know, them, you know, for example, the person with anxiety, we'll write a letter to that anxiety. You know, I'll teach them how to dialogue with that part of them. Okay, it's called parts work. You know, we all have different parts of us. You know, part of me wants to be here today. Part of me wants to be snuggled up and home, like with the boys, right? So
I see.
So yeah, we're talking with those parts of them, and you know, those are the things that really work and they help. With Catholic therapy, this is where things are really special. So we can do inner healing prayer. So we will, you know, we'll start session with prayer. We'll kind of bring the connection with Jesus to mind. You know, we'll ask the Holy Spirit for help with these insights. You know, getting insight into the memories and things, and then we'll listen. Right? We'll kind of be guided. It's not so much me doing the guiding then. It's you know, more directly guided by the Holy Spirit, right? And so that's you know, that where really special change can happen. So last phase of the approach is to seal in the change, you know. So we want to anchor in the change, you know. If rather than anxiety, you know, this person wants to, I'll ask them, we'll talk about what's the new response to these situations, right? So 2 nights ago, you know, when something similar happens, as happened 2 nights ago, how do you want to feel? How do you want to think when this happens? And so we'll do some more imagery, right? We'll talk about, you know, what does a serenity approach to that situation look like? One of my favorite anchors for things, for the serenity approach to things, is the serenity prayer. You know, you're familiar?
Familiar with that,
very
yes.
much, yeah. So yeah, Lord, help me, you know, give me the serenity to accept the things that I cannot change, the courage to change the things that I can, the wisdom to know the difference, right? And you know, with Catholics, we know we're surrendering to Providence and letting God take care of outcomes. So yeah, that's I know a long kind of overview, but that's my approach in a nutshell.
Okay.
Yeah.
What is an emotional or relational wound that's painful?
Okay, great. So I just want to bring up a couple slides to help us here.
Okay.
I'm going to go over, you know, some visuals. So part of my work and part of what I have fun doing is creating what I call insight anchors. Okay, little visuals, diagrams to help. You know, a lot of us are visual learners. So I just want to show some examples of relational wounds, emotional wounds, and just very abstract pictures. So this first one is a wound of feeling insignificant. Okay? Insignificant compared to others, you know? And that can come about for a number of reasons. But yeah, little Joey, you know, he's one of 8 kids, 5 boys, maybe I should say, right? And you know, he's kind of overlooked, you know, growing up, and he just has this sore spot for feeling less than his brothers, right? He's insignificant. So when he's as an adult and he's going through, you know, professional development, and you know, he's feeling like he doesn't. No, he
doesn't count.
Doesn't count, exactly right. And so that he's just carrying that, and he doesn't like feeling that. He knows it doesn't, you know, it doesn't fit with who he is, who God sees him. But he feels that way still, right? And so that's one example. Here's another example. And could you guess the wound, the emotional wound or relational wound there?
Outside of the circle.
Outside of the circle, yeah. Yeah, you're right. Yeah, outside of the group. Yeah, feeling excluded, you know. That's a big one. A lot of, you know, typically when we're doing our memory work, we'll go into, you know, adolescence or early grade school experiences. And yeah, you know, Susie and, you know, Katie they excluded me. You know, they wanted me to know that they were best friends, and I didn't. You know, I'm on the outside, and you know.
Don't count.
Right, don't count. Yes. Here's another one. Might be a little trickier, but this one is, pretty common. It is the wound of feeling misunderstood or not heard, or unheard, unseen, more like unheard, right? So other people seem to be able to communicate, and people get them and they understand them. But for me, when I speak, I just feel like nobody, really understands me, and I just feel so misunderstood, right? And maybe we'll do one more. This is the wound of not being chosen. This can come about with a failed romantic relationship, or a heartbreak, a rejection, or not, or somebody who's never had a romantic relationship, and they're in their 20s and their 30s, and
Yeah.
and they're just feeling, I'm not chosen. And I've got my friends, and I feel loved by them, but there's just this thing that's missing. I always desire just to be special to someone.
Yeah.
And so that's one that comes up, right? So yeah, those are some examples.
Okay. What causes emotional or relational wounds?
Yeah, so some of those difficult experiences, right? A lot of things come from hiccups in primary relationships, caregiving relationships, right, with parents. Sometimes, rather than, my parent let me down, or sometimes it's, I picked this up from my parent, right? When we're going into the root cause of things, the person will be, telling me their script, their thoughts, right? Their thoughts in certain situations, and then I'll say, who does that remind you of? Who does that sound like, right?
See.
And the person, sure enough, will say, oh, that sounds exactly like my mother,
I got
right?
you.
And so I'll say, okay, well, what age were you when you were around your mother and she was saying these things to herself, and oh yeah, it was about age 6 to 8, we were, moving around a lot as a military family, and all that
Okay.
stuff, so that's an example. Sometimes, it comes really early, like a pre-verbal, experiences can be stuck, that can be a source of a wound. A lot of early childhood attachment problems can come into play. Rejection from parents, or one that's interesting is enmeshment. So, the parent wants the child to kind of do and think and say, certain things, and then if they don't, if they kind of, if they don't have this special relationship with the parent, and if they choose something else, if they have a different opinion, that's a big no-no,
problem.
right? A big betrayal. So yeah, that's one that's hard to heal from, but not impossible, right? So
How can we avoid being wounded?
yeah, well, we can't, right? We can't. Yeah, we live in this world, Yeah, there's, another way to think of a wound is anytime we're not loved well, we're not loved the way that we should be loved.
Okay.
Okay, and yeah, that happens a lot, right? We miss out, and we're either something bad happens to us, or we don't get what we need. But there is hope. So what we can do is we can continue to check in with our hearts and what we're going through, and watch out for, triggering situations, or when bad things do happen, we can go to other people, right, and relate and talk through what happened. There's something about telling the story of what happens that's healing, and it helps our brains and our minds and our hearts and our soul to kind of work through it. Obviously, here's where grace is very important, and there's something very powerful about having a heart-to-heart talk with somebody, and also being open to grace, to the Holy Spirit, to listening at that deeper level, to grasp onto the truth, and to make use of prayer and for Catholics, the sacraments to heal from things, right? There's just this amazing, so many resources, such incredible gifts that we have in the church to heal from things, and so that experiences are not stuck, they're not weighing us down, who came to take on all these emotional burdens, all the burdens, the pain, the grief, the shame of all these things. Christ, he did. He came, and he's here, and he's always eager to take on our burdens. He wants to take these things on and help us through things. So, yeah.
What are some of the common emotional struggles that are faced by your clients, and how has your approach helped them? If you want to give some examples.
Right. I want to give two here. So one is discernment anxiety. Right, this is kind of my thing that I struggle with, and so I'll give an example. Young woman in her 20s came to me, and she was in a relationship, and it was a good relationship, a good guy, right? Good Catholic man, and but she was having some doubts, and so she came to me, and discernment is a choice between goods. So, if this was a bad relationship, it would have been an easy decision, but
easy out.
This was hard. So, so that was the problem, and that's what we started with. But with this approach, we got into what was making it difficult for her, and we got into some memories. She had, she did have some bad experiences, but a lot of it was not having parents encourage her own interests, and to really get excited and delight in her and what she wanted, and there was just something missing there. And so, we brought that to the Lord, and she experienced this change, this shift, and I thought when she came in, I thought she was leaning towards sticking with this great relationship, but she surprised me. She said, "No, we broke up last week," and I was like, "Wow, okay," and she talked more about the desires of her heart and how she came to that decision, and which was just beautiful. So, let me give you another example. A family came in, with a teenager, and there was growing conflict between the parents and the teen. In this case, it was a young girl, right? 15. We'll call her Emily.
Okay.
And so Emily, struggled with or I shouldn't say she struggled, but in the dynamic got really hostile, right? And so, she would yell. The parents would lose their temper at times, and a lot of distancing and
it happens.
Yeah, right. So what we did was I started with the parents. Right, we talked about communication, and the importance of communicating and giving her space to communicate when she's ready, and how to do that, right? How to reflect, not just feelings of sad or mad, but to reflect other types of feelings that teens deal with.
Okay.
Right? Teens they're struggling with independence, growing
tough time.
Yeah. Sense of autonomy. Am I doing things right? Or freedom. Like, I want more freedom, right? It's kind of like a drug that's you got to be careful with giving them too much. But,
yeah.
But so those communication skills really helped. They were doing pretty well with boundaries and giving her limits. That's another thing I usually check. But that helped her to start getting into her heart and getting into why she was so reactive to her parents. And so, she and I met for a few sessions, and it turned out that we kind of figured out the trigger of this conflict. So a few years earlier, she had made a big mistake, and one of her pets passed away, unfortunately.
Okay.
And it was very sad, right? It was what I call a trauma, and it was stuck. And it took a few sessions to work through that. but ultimately that helped. And so we also went back to the parents. We were working back and forth. And, I taught the parents too how to address her mistakes. So what the trigger was when they would tell her that, hey, you messed up here, you made a mistake. And so what happened when they would say that, she would, she would get reactive, right? She would react in different ways. But so, long story short, we worked it out and resolved things, and they haven't been back since. So yeah.
Okay, that's great. What is the grounding technique, and when can it be helpful?
Yeah, so this is one of the first things I teach people.
Okay.
Okay. A lot of us live kind of keyed up, in our heads, or we're kind of stressed. Maybe, we got a lot of things on our minds,
Understand.
So, yeah. So I'll just have somebody right in the first session. We'll do some grounding where I'll have them look at things in the room, and notice things, and stop making associations, and just look at the descriptive features of things, like that table, right? Notice the shadows on the table, right, and the texture and things. And what that does is it grounds you in your senses, okay? Touch is a really powerful one too. And so, helps you be more mindful, a more mindful state, helps you to go from sympathetic nervous system, right, fight or flight, to parasympathetic nervous system, rest, focus, digest. And it's really helpful for people to shift out of whatever mindset they're in. So, yeah.
Okay. How do you forgive others? What are the steps? I would imagine a lot of people have that quandary.
Oh, yeah. That is actually a big part of the work when we're going in that really core phase of therapy, when you're working through things that are stuck and unresolved. Forgiveness is very important. So, sometimes it's not just bad memories that we need to work through, but it's also, there's a spiritual level of the person. And forgiveness is very necessary to, we really need to make an act of the will to renounce certain judgments, certain, and I'm better than them, and those kinds of things that are traps for us and really get us stuck. I don't want to go into a lot of detail on exactly how.
Okay.
I do have something on my website that has a step-by-step guide, not from me, right? So with my website, I like to collect things from other people, other sources. But yeah, essentially we're letting go of things and working through some of the memories, but also asking for grace and asking for that grace to let go of the debt that person owes, the wound that they caused and things. So
Okay.
yeah.
How do you turn stumbling blocks into stepping stones?
That's a good one. So let me go to my visuals here. Okay, this one shows what the two principles that are at war in our hearts. Okay. Constant battle. So there's what they call the X principle. Okay, and that is where some painful experience is stuck, and what it does is it tends to divide our hearts, divide us. It divides us from God, it divides us from ourselves, it divides us from other people, and even from nature, from our bodies, right? And so a stumbling block is what we've been talking about, throughout our discussion. Some of those relational wounds, typically they're subconscious, that we're not thinking about these on a day-to-day basis. We can know that they're there if we do this kind of imagery work and checking in with our hearts. But for example, that young man who feels insignificant as a professional, and it's hard for him to advance, that's a stumbling block.
You bet.
So we want to shift that to replace that X factor, right? That's tending to sap his energy and sap his confidence and, disconnect him from his emotions and from trusting God. We want to replace that with the cross. Okay, so the X we want to replace with the cross. It's a very simple shift, but
understand.
The cross, that principle is where, again, this doesn't come from us and natural reason. This comes from grace, right? From truth. And so the vertical dimension is restored, so we're able to receive the truth and to know the truth that we are significant. We matter a great deal. And, it helps to be assertive, and so the horizontal plane comes into play where I'm connected to myself, I'm connected to other people, and I can assert myself and I can go after those things in my professional life. That can bring just a lot of energy and open up spiritual space to grow too. So when you the stumbling block in essence becomes a stepping stone to greater virtue and greater growth in life. So,
okay. What are insight anchors, and what's the goal or purpose of the website you created?
Right. So this...
And I think they'll see the website address on the bottom of the
absolutely,
screen.
yes. So this, I thought of having my website be called, like a catholictherapy.com, those kinds of things. But I love insight, right? I'm a big fan of insight and helping people have insight. And I also have struggled with the abstractness of philosophy and, psychology, even Catholic psychology, right? There's a lot of amazing, writers, professors, therapists, psychologists, and a lot of the writing that they put out is very abstract, and I love it, right? But for example, Father Rittberger is he's kind of getting more renowned, but he wrote a big tome on mental health from a Thomistic point of view, and
I gotcha.
There's a lot of philosophical jargon in terms in there, and I'm just going to give a couple examples of some of the things that I came across when I was a young, Catholic psychologist, and we're studying, the anthropology of man and things. So, there's this diagram of the substance of man. It goes into traditional, philosophical terms to understand how we're made. There's another slide here, the ontological structure of man. We do need to know, how the body and the soul interact, and, the intellect, the will, the emotions, those things are very important, right? Very over people's heads, though, And it's also not very practical when it comes to counseling. Somebody's walking in my office, I'm not thinking about, their interpersonal relationality, from a Catholic philosophical point of view. So what I've done with insight anchors is just kind of replace these diagrams with very simple visual tools, that, for this one, the mind, the body, and the will, there's certain shapes that go with them to recognize them, and we go after certain things in life with these powers and these aspects of us. More importantly, what I actually use in sessions sometimes is, and I'm going to do a transition here from one slide to the next here, and show how these powers are integrated in the human heart. Okay? And as I said, certain situations will trigger the X factor. They'll trigger that, what's traditionally called the privatio boni, the deprivation of the good, the evil, right? The traditional concept of that. And so what happens when the heart encounters some situation is that principle will get triggered and divide these different parts of us, right? And so this shows that very visually, very simply, and we can actually label these different parts of the heart. Most people who come in my office, can quickly identify how their heart responds to certain situations. For example, I spin the wheels of my mind. I worry. With this, when it comes to me dropping my kid off at school, I worry so much, and my mind is spinning its wheel, and it takes an hour of my day, right? And with my will, right, what I'm doing externally, I'm calling the school and I'm checking on them, and I'm, sometimes I'm picking them up too early from school, right? That's what I'm doing, right? There's this mother hen part of me that's going after there. So, there's I know that's wrong, it's not helpful, but I do it. And then usually there's, at the bottom there's what we go for in counseling. We want to go to the memories, with body held memories, and what's actually tying in that wound, right? There's different episodes in their life, and we got to kind of go in there. But this just shows you how I want to really make things more simple, quick, intuitive, and just useful too in counseling, right? So, yeah.
Okay. Well, I like that simple approach.
Great. Yes. Yeah. It's really, the clear, concise, simple. Yeah. You got it.
What advice would you give someone who aspires to be a therapist?
Well, I would suggest, keep working on your own, emotional wounds and relationship, hiccups and things. That's one thing. It's really important to have that self-knowledge.
Okay.
To get to know the way you're thinking. But it's also very important to find a place, a community, a training program, mentors that you aspire to be like, right? I think that was so foundational for me.
Okay.
To have people, form me and encourage me, and give me some great training. So yeah, that's that's kind of the gold nugget there for them.
Okay. How would someone get in touch with you? Do you have an email address and a telephone number?
Yeah, so they can go to my website. It's insightanchors.com. They can email me. Email address is marcel@insightanchors.com. They can call me. My info's on the website. If somebody's interested in booking a consultation, they can do that through the website. And I also do speaking and things like that. So yeah, that's also a possibility.
Okay. In summary,
Yeah.
And I ask everyone this question,
right.
What is making sense and what doesn't?
Yeah. So what doesn't make sense to me is what I did in my 20s. Right, I just kind of soldiered it out. Right, I knew I was having some difficulties with certain things. Right, and I got in this mode where I was just functioning, right, kind of like a robot. And so that doesn't make sense to me, to think, I just have to soldier it out and just, pray the rosary more. Well, that helps, but, just do, the things I've been doing. But yeah, what makes sense to me is to trust that emotional insight and change is possible, right? That healing is what God wants for us. That healing and that wholeness is what He desires and wants for us, and He offers us. So yeah, seeking that out through various avenues just really makes a lot of sense to me. Right.
Okay. Well, thank you very much for coming on and giving us those words of wisdom. if someone wants to get in touch with you, I know your address and phone numbers and all that will be on the bottom of the screen.
Yeah.
And thank you for watching. If you do have comments or questions, you can get in touch with us. If you would like to appear on the show, or you know some interesting people that you think would like to appear, please send us their contact information. And remember, seatbelts save lives. Thank you.
The preceding program was presented to you by a community producer. The statements, views, and opinions expressed were not necessarily those of ALC TV or the City of Avon Lake.